Hi, Dr. Butler here. Thank you again for taking the time out of your day to learn more about your health. I wanted to share with you my thoughts on diabetes. I'm doing some continuing education here on the computer and kind of reading through these studies that have been done on individuals as it relates to premature death, as it relates to diabetes, and predominantly we're talking about type 2 diabetes. Type 2 diabetes is considered an adult onset diabetes versus type 1, which is generally speaking considered juvenile diabetes, or usually the age of onset is earlier in people's lives and considered more of an autoimmune condition. Diabetes type 2 is heavily prevalent. I just looked. I believe what they said is it affects 8.3% of the world's total population. That's a pretty significant number if you kind of wrap your head around it, and the impact of diabetes as it relates to our healthcare dollars, the amount of spending that goes into addressing and treating diabetes is pretty significant. What really gets me going, though, is the concept as I read this that diabetes is this epidemic, and it is if you look at the numbers, but diabetes is not an infectious disease. When I hear that word epidemic or pandemic, we've related that a lot in the past to things like smallpox, or things like the plague, or we have a cancer epidemic right now too, not just a diabetes epidemic. And in truth, we have a chronic illness epidemic. And it's totally different, in my opinion, than an epidemic that's associated with acute illness, such as infections. Infections that are created by viruses or bacteria are pretty, how should I state this? You can be Superman, and if you get enough smallpox virus, you're gonna get sick. It's a pretty simple numbers game. If you get overwhelmed enough with an organism, it overtakes you, the organism, and you can get mortality, you can die from it, you can get sick from it, and so forth. So it struck me when that word came up. We have this diabetic epidemic, and we better prepare to keep understanding it and get better prepared for all the what are called comorbidities associated with it, which are these cardiovascular. Morbidity is a disease, and it's cardiovascular illness. So people who get diabetes get cardiovascular illness. People with diabetes get kidney disease. People with diabetes have a higher risk for cancer rates. And it's, in my opinion, this very backward way of thinking about things when we're just trying to take care of, again, the symptom or the effect that's being driven out of this cause, which is called diabetes. And diabetes, I am telling you, is one of the most straightforward health conditions to treat with individuals. Literally, it's all about sugar. Now, again, I'm talking about type 2 diabetes, not type 1. Type 1 absolutely has a sugar factor tied into it, but it's a whole different ballgame because of, again, the autoimmune impact on the pancreas and so on and so forth. So, but type 2 diabetes, which is the predominant factor, or not factor, but predominant part of the disease. When we talk about the impact of diabetes on our populations, that's the biggest part that's affecting people, and it's highly treatable. I always see patients that come in and their doctors tell them, well, you have diabetes, you're kind of destined to have diabetes, it must be in your genetics, and you're just going to deal with it the rest of your life. So get prepared to go on metformin, and then eventually you're going to have to go on lisinopril, or at the same time you go on them, and then you're going to have to go on maybe another oral anti-diabetic therapeutic like glyburide, and then eventually you're going to go on insulin. And there's just this belief that you're just kind of, pardon my French, but screwed. You got it, you're going to have it, it's going to keep going. And that entirely, in every which way is not the case. I mean, I don't see that with my patients. Maybe in an environment where you're not educating people and helping them understand about their role in their healthcare and the choices that they make and the impact that it has on the way their body functions. If that's not part of your reality, then absolutely the same thing's going to keep happening. You know, continue to do the same thing, expect a different result. The insanity, it won't happen. Same thing will keep happening. But in my patient population, someone comes in and they have diabetes. The first thing we start looking at is, what does your sugar intake look like? And sugar is not just ice cream and cake and all of that. I mean, there are some pretty obvious places that we get high sugar in our diet, and of course, people with diabetes can't do that. You know, but then you have to look at these other places within their nutrition that impacts their blood glucose metabolism. Then you start getting into grains, you start getting into concepts around paleo diet, or, you know, these diets that start taking out high carbohydrate rich foods. And again, it is so straightforward. You remove the burden of high sugar, high carbohydrate rich nutrition, and there's definitely a handful of other things that you work with, you know, the individual around with their lifestyle and with detoxification therapeutics. But the number one thing that has the most dramatic impact is that nutrition. You do that, and someone's A1C, which is a marker, you know, kind of the most common marker now for diabetes, it goes from 11 to 6 in 3 months, and it seems like, whoa, this miraculous thing that happened. And I have patients that go talk to their other doctors, and it's like, you know, that must be, you know, a fluke. You know, there's something, a miracle or something. And I, of course, believe in miracles, but it's not a miracle. The person just changed the level of their blood sugar metabolism through the type of fuel they're bringing into their body. You do that, in essence, diabetes goes away. But here's the truth, it doesn't go away. Things don't just go away. Things become managed based upon the choices that you make and the influence that your choices have on your body's physiology. You change your nutrition as a diabetic, your blood sugars will normalize. And this, when I was in school, you know, I always would question people when, you know, people would say something like I'm saying right now. It's like, oh yeah, well, what happens in 3 months after, or 6 months? You know, what happens a year after that, 2 years? You know, does the person stay better? The person, the patient, you will only stay better if you continue to do and make the choices that you initially made to correct or change the direction of physiologic function. You know, it's like I was doing this and I had diabetes and I had a high A1C. Now I do this, I have a low A1C. Generally speaking, my lab values do not diagnose diabetes. And wonderful, I feel better. And that's, of course, in the end, all this is all about feeling better. You know, it's just knowing that if you make a change and things improve, you have to continue to keep doing what you did to create the improvement. If you go back and did what you were doing prior that caused the state of adversity to occur, you go back and start eating a bunch of bread and pasta and bagels and crackers and ice cream and all that stuff, guess what? Diabetes comes back. So it's not this all or nothing, it's this spectrum that we run in. Everything is dependent upon the choices that you make and the impact that those choices have on your health. So when you look at studies like this and the information that we're getting about diabetes as this epidemic, it's gonna just continue to keep happening, which is true. It will continue to keep happening if we do the same thing. But the idea that the way we're going to manage it is by throwing more healthcare dollars and more resources at the, you know, at the effects that occur per a diabetic environment is, in my opinion, crazy. It'll just keep perpetuating the same type of reaction and response. So
We have to work with the individual. The doctors, your healthcare team, who you're surrounding yourself with, you have to be working with people who are pushing you and helping to educate you on what you need to do to change the environment that your physiology is running in. And again, and it's not complex. I always like to say it's very simple. It's just hard. It's hard for people to change. It's hard for them to do something different. But being hard is not an excuse for not doing it. I always like to tell my patients things that are worthwhile, that take effort, that take perseverance and diligence are what, create wonderful results, long-term, beneficial, wonderful results. You put effort and love and consistency into a relationship. It's hard, but if you put the work in, you build a good relationship, right? Your job, anywhere, you save money. It's hard to save money. I'd rather spend it here, but I save it and I keep it. And wow, my hard effort now has created this stability for me. So your health is absolutely worth it. It is hard, but it's not complex. You have to nourish your body appropriately. You have to eat appropriately. If you have diabetes, you can't eat sugar, period. And people will try to talk to me all day long about, but Dr. Buttler, what about a little bit? And I had a patient one time tell me, and it was wonderful. He's like, "Where's the grace in that? Where God gives me grace. Where's the grace in you telling me that I have a narrow margin and I can't get out of the margin?" And I get that on one hand. I mean, everybody has to have some capacity for wiggle room, but it's knowing, like, in truth, you don't, and that doesn't mean you're going to be perfect, but it's persistence. So diabetes, treatable. You can treat it. It can get better. You can get it to a point where it's a non-issue, but you're going to do it through changing your lifestyle, changing your nutrition, detoxifying better, moving more, sleeping better, belief system, huge. We won't talk about it now, but remember, everything's going to be okay. When everything's okay, blood sugar's steady. When you go into a place of fear and everything's not okay, your blood sugar starts going into a place of deregulation. So does insulin. So again, it's not an epidemic. It is an epidemic and will become an epidemic based on the fact that we're not looking at it appropriately. If we look at it appropriately, we educate our patients, we give them the tools to take care of themselves, and then we consistently back them up and keep working to encourage them to change their behaviors, we will have wonderful outcomes and sustainable. We just have to have our energy be focused there. So thank you again for taking the time to learn more about your health today, and we'll see you next time.